Hi, welcome to the Silicon Valley Health Institute. We are a nonprofit organization that brings you leading health experts so we can make moves to have optimal health. You can get on our email list. You can send an email to our website, www.sdhi.com, where we archive all of our meetings, or you can join our meetup. So today with us, we have Dr. Andrew Budson, who is the Chief of Cognitive and Behavioral Neurology, as well as Associate Chief of Staff for Education and the Director of the Center of Translational Cognitive Neuroscience at the Veterans Affairs Boston Healthcare System. He's also the Associate Director for Research at the Boston University Alzheimer's Disease Center. He's a professor of neurology at Boston University School of Medicine and lecturer of neurology at Harvard Medical School. He's also the medical director of the Boston Center for Memory, located in Newton, Massachusetts. He's published over 100 papers and reviews and book chapters, and is a reviewer from over 40 journals. He's co-authored or edited 5 books, including Memory Loss, Alzheimer's Disease and Dementia, A Practical Guide for Clinicians, the second edition of which has been translated into Spanish, Portuguese, and Japanese. So welcome, Dr. Budson. It's a great honor to have you here.
Well, thank you so much. It's a pleasure to be here with you today and all of your participants. It is a wonderful thing to be able to communicate with so many people so easily over this electronic platform. So there are a few silver linings to this pandemic. So I want to begin by telling everyone what my plan is for this afternoon. So I'm going to begin by doing a little bit of an interactive talk. And what I mean by that is, although I would prefer that you hold your questions till the end, there are going to be times when I'm going to ask for you to give me a thumbs up or a thumbs down. I'm going to be asking you to raise your hand to do different things during the talk. And I'll be just talking with you sometimes like this. Other times I'll be reading a little bit from my book, 7 Steps to Managing Your Memory, now out in paperback, as well as Kindle and Audible and hardcover. And then that will take about, and I'll be showing some slides as well. And that will take about 50 minutes, 50, and then we'll break and we'll do questions, and I'll answer questions both in the chat as well as if you want to speak your question, that's fine too. And then after that, it'll be sort of up to you what we do. We can just roll with the questions if there's a million good questions. I also prepared a little bit on how to remember names better, because that is something that I think all of us struggle with. And if any of you are interested in learning more about how to manage the later stages of memory loss, like Alzheimer's, dementia, I'm going to be ready to talk about that as well. So I have sort of a script for the first 50 minutes, and then the rest of the time, I want to do what you all would like to do. So with that little preamble, let me dive into it. I'm going to begin by sharing my screen. And so I think you can see here that my little titles, and these are the 2 books that I have written for the public here, and we're going to be, like I said, going through the 7 steps one in detail, and then the 6 steps to managing Alzheimer's disease and dementia we can do depending upon interest. So let's dive into this one here. We're going to go through all of these different steps, but I'm going to begin by reading a little bit from the preface to get a sense as to what people know. And what I'm going to do as I read through the preface is I would like all of you to give me, so I'm going to read through some common memory scenarios. And as I read through them, if you say to yourself, you know, this is just part of normal aging, it's just what happens when you get a little older, either give me a thumbs up with your actual thumb if you're showing your video, or give me a thumbs up using the reactions, okay? And if you think that this is not normal, could be Alzheimer's or dementia, something like that, then don't give me a thumbs up. So here's the first scenario. So you walk into a room to get something and you forget why you're there. What do you think? Thumbs up or not? All right, come on, everyone. I want to see a big thumbs up from everyone out there, because that is absolutely normal, right? Woo, thank God. If that one wasn't normal, I think we'd all be in trouble, right? Okay, let's take a look at the next one. You're having trouble remembering some of the details of your life, such as your wedding. What do you think? Is that normal? Thumbs up or not normal? Got some thumbs up, some not thumbs up, some thumbs down. Okay, let's take a look at the next one. When you are driving and not paying attention, you take one or more wrong turns and you end up somewhere you did not intend to be. What do you think? Is that normal, thumbs up, or not normal? So again, we get some split decisions. Some people give me the uh-oh face. Some people give me the laughing till you cry face. And you notice, by the way, I'm not telling you the answers to these other ones. So you can vote your heart and you won't have to worry about being embarrassed. How about this one here? You have difficulty finding your car in a parking lot. What do you think? Normal? Not normal? Most people are like, that one better be normal, right? And how about my favorite one here? Your family tells you that you've asked that question before. What do you think? Normal? Film Jedi gives us a thumbs down on that one. Well, it is my job this afternoon to empower you with the knowledge so that you will know whether these and other common memory problems that you may be experiencing or you may see in a loved one, whether these things are normal, whether they're not, and most importantly, what to do about them. But before we get into the 7 steps to managing your memory, I want to introduce you to 2 characters that we wrote into the book. These characters are in there both to make the book a little bit more engaging and accessible, as well as to illustrate the 7 steps to managing your memory. Now, I did want to let you know that in addition to the stories, don't worry, there's plenty of sort of detailed content as well. But during a book talk like this, when I do read, it'll be from the stories, because it's a little bit more fun. So here's the first little story. That could have been embarrassing, Sue thinks to herself. She was halfway through lunch with one of her closest friends before the name of her friend's husband came to her. How could I have forgotten? She thinks again. She was able to remember everything about him except his name. Now, Sue was able to cover for this little memory lapse. In fact, she has become quite good at covering for memory lapses such as these and laughing it off when the lapse was noticed. Sue herself, however, isn't laughing. Sue is worried about her memory. Worried, in fact, is a bit of an understatement. She is absolutely terrified that she is developing Alzheimer's disease. She just turned 80, the same age that one of her friends, Mary, was diagnosed with the disease. Now, Sue has not mentioned her concerns to her friends or her children. Her children will only worry and overreact, and she doesn't need that. She hasn't mentioned her concerns to her friends either. It would only make them anxious about their own similar memory difficulties, or worse, they would start to treat her like an invalid and stop including her in their social activities. Sue thinks about some of her other memory lapses. Just yesterday, she walked downstairs to the basement and could not remember for the life of her what she was going down to get. It was only when she walked back to the kitchen that she remembered the roll of paper towels that she needed, which she then successfully retrieved. Now, she doesn't have difficulty remembering what happened yesterday or the day before, but she finds it quite difficult to remember things from her childhood. Is that normal? Sue isn't sure. So that's a little bit about Sue. Let's take a look at our next story. This is about Jack. Now, Jack has just come from his local community lodge where Sam, one of his buddies, said, "Jack, you should get your memory checked out. I'm worried you could be developing Alzheimer's disease or dementia." Could he be right? Jack thinks about Sam's words. He's not sure whether he should thank Sam or slug him. Part of him wants to do both. Deep down, he knows that Sam is trying to be helpful, but he has a lot of nerve. Sure, Jack knows he has some memory problems, but who his age doesn't? Just because Sam's wife has dementia, all of a sudden he thinks he's a goddamn doctor. Not that the doctors know very much about memory problems from what Jack could tell. Sam had to take Mary to her doctor 4 times before the doctor actually did anything about it. Jack considers his memory. He didn't think any was wrong, at least not any more than with anyone else his age. He is 72 after all. About half his friends have similar difficulties remembering what they did yesterday or were going to be doing the following day. The more Jack thinks about it, the more he thinks his memory probably is normal, better than normal, in fact. How many people his age can list off their buddies from high school and the make, model, and year of the cars that they drove? Still, Jack feels unsettled. Sam stressed that the reason he was bringing it up is there were medications that Jack could take that could improve his memory. He doesn't want to be stupid. After all, he's never been one to run away from a problem. He'd rather stand and confront it. Perhaps he should call his doctor. So that's a little bit about our characters. And now we're going to dive into the 7 steps to managing your memory. And we are going to begin with step 1, learn what is normal memory. So let's say there's something that you need to remember, like someone's name. So how does this actually work? So I'm going to give you a filing system analogy as to how it works. So the first part of the filing system that we're going to talk about is your file clerk. Now, your file clerk is actually a part of your brain. It's your frontal lobes right behind your forehead. And it's the job of the frontal lobe file clerk to take information in from the outside world and to put it into the memory file cabinet. Now, when we need to retrieve a memory, the file clerk walks over to the file cabinet and pulls out the information. So that's what happens as part of normal memory. Now, guess what? As we all get older, our frontal lobe file clerk is getting older too. And I'm going to give you an analogy as to what happens to our older frontal lobe file clerk. So the first thing I want to mention is that as our file clerk gets older, she does not hear quite as well as she used to. What? And because of that, information may need to be repeated a couple of times before she's able to get a hold of it and put it into the file cabinet. Now, another thing that happens to our older frontal lobe file clerk is she does not move as quickly as she used to. And because of that, as she is trying to retrieve a memory, it may take a little bit of time before she walks over to the file cabinet and pulls out the information that she's looking for. Now, the third thing that I want to talk about is our older frontal lobe file clerk does not see quite as well as she used to. And because of that, when she is trying to find a memory that she's looking for, she's going to be scanning up and down the file cabinet, and she may need a hint or a cue in order to find the information that she is looking for. But importantly, as part of normal aging, if the information made it into the file cabinet, it should be able to be retrieved, even if it takes a little bit of time or a hint or a cue. So in a nutshell, those are the changes we expect to see as part of normal aging. So now we're going to jump to step 2, which is determine if your memory is normal. And this time, we're going to continue with our filing system analogy, but we're going to focus on the file cabinet. Now, the file cabinet is another part of your brain. It's called your hippocampus, and it's deep in your temporal lobes. So if you put your fingers on your temples just behind your eyes, it's deep in there. Now, the problem with Alzheimer's is that Alzheimer's damages and ultimately destroys the hippocampus. And the way I think about it, it's sort of like if you pulled open the file drawer and you look down inside, you would see a big hole in the bottom of the file cabinet. Now, if there's a hole in the bottom of the file cabinet, you can have the best, most efficient file clerk in the world pulling information in from the outside world and putting it into the file cabinet. But what's going to happen? It's going to disappear into the hole, never to be retrieved again. And when that happens, even when information is repeated, even if you wait a bit of time or a hint or a cue, you cannot retrieve the information. And when that happens, we call it rapid forgetting, because the information is rapidly lost. And rapid forgetting is never normal. It should always be evaluated. Now, let's catch up with Sue to talk about some of the other memory problems that happen in Alzheimer's disease. Now, Sue, as you know, is worried about her memory. And one of her best friends is Mary, who was diagnosed with the disease. So Sue was having a cup of coffee with Mary's husband, Sam, to learn a little bit more about it. How did it start with Mary? Sam looks closely at Sue, seeing the worry in her eyes. Well, everybody's different, but I think with Mary, it began when she got lost while she was driving. Mind you, I didn't know what was going on at first. I just knew it would take her a long time to go from one place to another. Looking back, I also realized that she began to travel to fewer places. First, she didn't drive on the highway. Then she didn't drive in the city. Then she didn't drive anywhere new. I didn't think it was a big deal at first. I mean, who really wants to fight the traffic in the city or on the highways anyways? But I began to realize that where she was getting smaller and smaller and smaller. Now, the red flag to me was when I got a call from the doctor's office at 2 o'clock in the afternoon saying she had not shown up for her 1 o'clock appointment. So now I'm starting to get nervous. Was she in an accident? Was she okay? A few minutes later, she comes through the door in tears, telling me she could not find the doctor's office. That was the thing that really made me realize that something was wrong. So let's talk about getting lost for a minute. Anybody of any age can get lost. You make a wrong turn, something doesn't look familiar, bam, you're lost. But what do we all normally do? Well, you can pull out a map, maybe from the glove compartment, or in this day and age, more likely from your phone. You can use a GPS device, or you can pull over and ask for directions. And using any of those things, you're back on your way. But the problem in Alzheimer's is that paper maps and phone apps and GPS devices can be complicated and confusing to use. You can pull over and ask for directions, but they're often long and detailed and hard to remember. And it's for all of these reasons that getting lost is such a problem in Alzheimer's. Now, another thing that can happen in Alzheimer's is that people can lose things, misplace things. But guess what? Misplacing things is also pretty common in general. I want you to give me a thumbs up if you have had difficulty misplacing keys, glasses, wallet, pocketbook, cell phone in the last year. Has that happened to anybody? Yeah, me too, me too. So the question is, if you're misplacing things, how do you know? Is it normal or is it not normal? Well, if you are someone who every morning, you get up and you spend 5, 10, 15 minutes, hunting around the house, trying to find, where you put different things. And now you're getting a little bit older and you're still spending 5, 10, 15 minutes hunting around the house for things. Well, guess what? That's probably normal for you and not something to worry about. But if you were someone who was always very organized, never had to hunt around for things, and now you're spending 5, 10, 15 minutes, maybe 20 minutes, maybe an hour, maybe you had to buy a new cell phone because it never did turn up, maybe you had to cancel the credit cards because you never could find that wallet. Well, that could be a problem. So the point I'm trying to make here is it's not only what the problem is, but whether it represents a change from the way things used to be. Now, the last thing I want to talk about in this section is about repeating questions and stories. Now, anybody can be halfway through telling a story to a good friend and you say, "Oh my God, I told you this already, didn't I?" And anybody can forget the answer to a question and need to ask it again. But when there is a pattern of repeatedly asking the same question again and again and again, or telling the same story to the same people over and over and over again, that is not normal, okay? That is usually due to that rapid forgetting that we were talking about, because people rapidly forget the answer to the question or the fact that they've told that story already. And as I mentioned, rapid forgetting is never normal. It should always be evaluated. Okay, so let's continue the 7 steps to managing your memory. And we are going to move on to step 3, which is understand your memory loss. And we're going to begin with the most common question that I get asked, which is, what is the difference between dementia and Alzheimer's? Now, I want you to give me a thumbs up if you're familiar with the term dementia. I expect to see a thumbs up from everyone here. Now, give me a thumbs up. Good. Give me a thumbs up, or keep your thumbs up if you're familiar with the term Alzheimer's. But now what I want to see is give me a thumbs up or keep it up if you have a very clear understanding as to the distinction between dementia and Alzheimer's. Few people feel comfortable with that. So it can be a little bit tricky. So let me spend a minute just going over that. So dementia is a general term that simply means that there's a decline in thinking and memory to the degree that day-to-day function is compromised, okay? And the way I think about this general term dementia, I think of it as analogous to another general term like headache. So a headache can be due to a lot of different things. You can have like a migraine headache or a muscle tension headache, neither of which are very serious. But you can also have a headache from a stroke or a brain tumor, which obviously are very serious. And so it's the same way with dementia. You can actually have dementia from something as curable as a vitamin deficiency or a thyroid disorder. But you can also have dementia due to a variety of brain diseases, including Alzheimer's disease, frontotemporal dementia, dementia with Lewy bodies, vascular dementia, and there's many other types as well. So dementia is the general category, and Alzheimer's is one type or one cause of dementia. Let's talk about another term. Give me a thumbs up if you have heard of the term mild cognitive impairment. Has anybody heard about that? Yep, yeah, a number of people have heard about that term as well. So let's spend a minute talking about mild cognitive impairment. So mild cognitive impairment is when three things are present. The first is when someone is concerned about their memory. It can be the individual themselves, it can be their family, or it can be their doctor. The second is that when the individual undergoes pencil and paper testing, yes, indeed, a problem is found. So the concern is confirmed by the pencil and paper testing. But the third thing is that their day-to-day function is fine. And if their day-to-day function is fine, then by definition, they do not have dementia. So if you follow people with mild cognitive impairment over time, what you find is that about half of the people do end up declining and developing either Alzheimer's or another cause of dementia. But that also means the other half don't, right? The other half either then stay stable or they actually improve. You might say to yourself, how does anybody's memory improve over time? Well, one common cause of memory loss is depression, low mood. And if their mood lifts, their memory can get better. Another common cause of memory problems are medication side effects. And if the individual works with their doctor and their medications get adjusted, their memory can improve. Okay, so now we're going to move on to step 4, which is treat your memory loss. And before I talk about the treatments, I need to tell you a little bit more about Alzheimer's disease so you understand how the treatments work. So Alzheimer's starts with an accumulation of a protein called beta amyloid. Now, the amyloid clusters and clumps together to form plaques. Now, the plaques start to interfere with and damage neighboring brain cells. And inside the cells, another protein called tau, T-A-U, becomes loose. And the tau is very sticky. And it sticks to itself. And it forms these long chains, which get all tangled up. So these are the plaques and the tangles that you might have heard about in Alzheimer's. Now, the tangles end up killing the brain cells once they form. And normally the brain cells are making neurotransmitters, different chemicals that allow the brain regions to talk to one another. And one of the most important chemicals is called acetylcholine. And so in Alzheimer's disease, the levels of acetylcholine drop. It's for this reason that the mainstay of treatments are medications that can help to raise up the levels of acetylcholine. So these are medications that I bet many of you have heard of. Some of you may be taking these medications. So these include donepezil, whose brand name is Aricept, rivastigmine, whose brand name is Exelon, and galantamine. All of these medications can help to turn the clock back on memory problems. Because what the studies show is that these medications can actually turn the clock back on the disease by 6 to 12 months. So what do I mean by that? What I mean by that is when someone comes into my office and I prescribe them one of these medications, I can make their memory like it was 6 months before, or maybe even a full year before. And guess what? The sooner that they come to see me, the more likely it is that I can turn the clock back a full year, for a very simple reason. There are more brain cells that are still living that can actually, the drug can work on. Now, I talked about turning back the clock by 6 to 12 months, but unfortunately, I cannot stop the clock from ticking down. So what that means is if I see someone 2 or 3 years later, yes, they are likely to be worse off than when I saw them originally. But that does not mean that the medication isn't still working, okay? Because people are always going to be 6 to 12 months better being on the medicine than not on the medication. And in fact, if people stop the medicine, what can happen is someone can plummet 6 to 12 months worth of memory function in 1 to 2 weeks, okay? So once someone has had a good response to this medication, I pretty much want them to stay on it forever. Now, wouldn't it be wonderful if we could actually slow down the decline? And there are medications that are in clinical trials right now that may be able to do that. There's medications that are using antibodies, which are normally made by the body to fight against viruses and bacteria, like the COVID vaccine makes antibodies against COVID. But these antibodies are made in a laboratory. They're given once a month through the vein, and they will stick to either the plaques or the tangles to remove those plaques and tangles from the brain. There's also lots of other approaches that are being tried. People are using flashing lights to try to induce certain biorhythms in the brain that can remove the amyloid plaques. And those trials are looking promising. There are other trials that are looking at the microbiome in the gut and the relationship between the gut and the brain, and seeing if by altering the microbiome in the gut, can you clear these amyloid plaques? So those are not proven therapies yet, but they're in clinical trials right now. Okay, let's get on to what's usually everyone's favorite part of this talk, which is modify your lifestyle. And we are going to catch up with Jack in our stories. So Jack has been invited over for dinner by his daughter, Sarah, so that Sarah can show her father what eating a healthy meal is like. So what meat are we having? Asked Jack. We're having fish, Sarah says, as she dips a brush in olive oil and bastes a large piece of fish. Also on the roasting pan are several garlic cloves and 2 large onions. Waiting for the fish on the serving platter are some avocado slices and lemon wedges. What? No meat? Not even chicken? No, Sarah says. Fish, beans, and brown rice. I want you to see how delicious a healthy meal can be. Jack inhales the aroma of the roasting fish. This actually smells pretty good. Where did you learn to cook like this? I took a class on Italian cooking. These foods are all part of the Mediterranean diet. It's one of the very few diets that has been proven to be good for your brain. And of course, Sarah is exactly right. The Mediterranean diet and some of its cousins, like the Mind diet, are the only diets that study after study after study have proven to be good for your brain. So the Mediterranean diet includes fish, olive oil, avocados, fruits and vegetables, nuts and beans, and whole grains. There's a similar diet that was also extensively studied called the MIND diet. That's mainly the Mediterranean diet, but it also includes chicken or other poultry 2 times a week. And it's also looks as good. Okay, so now that you all know what's good to eat, you're probably wondering, well, what are the things that are not good to eat? Well, I hate to tell you, it's almost everything else. So red meats, fried foods, fast foods, butter and margarine, pastries, and most sweets, white bread, white flour, white rice, sugar sodas, and diet sodas, all of those foods I would put in the category of once in a while food, not every single day food. Now, before everybody gets really depressed and thinks, oh my God, I can never have dessert again, I did want to let you know that chocolate in small amounts has been shown to benefit thinking and memory and mood. You just have to remember that it's what type of chocolate? That's right, dark chocolate. The darker, the better, okay? Because it's the cocoa that's good for you, right? Not so much the sugar and the butter and the milk that they put into it to make it sweet and creamy. All right, now we're going to talk about exercise, and I don't need a show of hands or a thumbs up to know that everyone out there knows that exercise is good for you. But I will bet you that I can tell you at least one new thing that you did not know before you joined this Zoom this afternoon about just how good exercise is for you and why. Now, if I inspire you, before you lace up your jogging shoes and go running around the block this afternoon, I do want you to just check with your doctor and make sure that your heart and your lungs and your bones and your joints are ready for whatever increased exercise you want to do. But having said that, there is exercise that everybody can do. In fact, most of the studies that I'm going to be talking about were simply done with brisk walking, which is a good exercise all by itself. You can ramp it up and you can do jogging. You can do biking that tends to be lower impact on the joints. Swimming probably has the least impact of any exercise. You can also do different types of classes. You can move in a pool. And for those of you who can't move their legs, there are arm-only exercises that are incredibly vigorous. So no problem if you need to do arm-only exercises. If you're not sure what exercise is right for you, ask your doctor. Now, how much and what type of exercise to do? Well, the recommendations are to do at least, note that I'm saying at least 30 minutes a day, 5 days a week of aerobic exercise. And as I'm sure you know, aerobic exercise are things that get your heart beating fast, gets you breathing heavy. That's how you know it's aerobic. Also recommended are 2 hours a week of exercise to help with strength and balance and flexibility. So these are things like yoga, Tai Chi, Pilates, and isometric weightlifting. All right, let's talk about some of the benefits. Well, everybody knows that exercise regularly can reduce heart disease and strokes, but it's worth mentioning because strokes are a major cause of memory loss. So it's worth the exercise just for that alone. In addition, exercise reduces your risk of falls. And if you fall and hit your head, that can cause memory loss too, and is another frequent cause of memory problems in the elderly. You probably know that exercise is a wonderful antidepressant. And in fact, studies have shown that it is as good an antidepressant as many pills that are currently being prescribed today. Exercise also improves sleep. You might be saying, well, that's good, Dr. Budson, but what does sleep have to do with memory? Turns out sleep has a lot to do with memory. I'm going to tell you just 3 of the reasons. The first is what I think of as sort of the obvious one, which is if you have poor sleep the night before, you're going to be tired the next day. And if you're tired, it's going to be difficult to pay attention. And if you can't pay attention, you can't learn new information. Now, the second reason I want to tell you about is that we all make a little bit of this beta amyloid protein during the day, but we normally clear it away each night while we're sleeping. So if we don't get a good night's rest, we won't be able to clear away the amyloid protein. The third reason is it turns out that if we don't get good sleep, we won't be able to hold on to our memories for a lifetime. And let me explain why. We talked about how our new memories are formed and then stored in the hippocampus, in our temporal lobes. Well, it turns out there's other brain regions in the cortex where all the older memories are stored. And the transfer process from the new memory file cabinet to the older memory file cabinet happens when we sleep, okay? So we need to get a good night's sleep in order for this transfer process to take place. But the most exciting thing I want to tell you about in terms of exercise and memory is that exercise actually helps you to grow new brain cells. And it's so powerful, this effect, is you can actually measure the difference on an MRI scan in as little as 6 months. So people sometimes ask me, Dr. Budson, isn't there some magic bullet out there that's going to actually help me improve my memory? I say, yes, there is. It's called exercise. Exercise truly is the magic bullet. Okay, so that's step 5. And now we're going to turn to step 6, which is strengthen your memory. And we are going to again catch up with Jack. Now, Jack and his daughter, Sarah, have gone into a little argument. Sarah has purchased a subscription to an online computerized brain training program, and she would like Jack to spend at least 30 minutes each day working on it. Can you just try it, Dad? I don't like those things, Sarah. I'm no good at computers. I know you're a whiz at this computer stuff, but I'm not. Computers make me feel old and stupid. I'm not asking you to become an expert. I just want you to try it. The website says it can make your brain smarter and make your thinking and memory younger. Sarah, I know you're trying to help me, but I want to go to my pottery class so I can finish my project. And then I'm meeting the guys to play hockey. I don't have time for this computer stuff. Can't you miss your hockey game for 1 week? And your hockey game sounds more like a social event anyways. You spend 1 hour playing and 2 hours chatting over dinner. So what's wrong with that? We like to have dinner after playing, and I'm working on eating better, just like you showed me. Can't you just try the computer, Dad? All right. For you, Sarah, I'll give it a try. But I'm still going to go to my pottery class and then go play hockey with the guys. Making sure he is on the right page of the website, Sarah leaves her father to the computer training. Jack looks at the clock. Okay, he thinks to himself, I can spend 30 minutes on this computer stuff and then have time to go to my class and get ready for hockey. Jack completes the first set of exercises on the computer. Well, wasn't as bad as I thought, but I don't feel any smarter. All right, you ready? So what the studies show is if you spend time on crossword puzzles or Sudoku or computer games, you get better on crossword puzzles and Sudoku and computer games. It simply does not translate. into overall general brain function. But there are some things that do, and guess what? Jack was doing all of them. So let's review them here. So the first thing we already talked about, right? He's playing hockey, which is aerobic exercise, which is good for your brain. The second thing we also talked about, which is he is working on eating a Mediterranean style menu. But the third thing is that he is participating in social activities. And study after study after study has shown us that social activities are critically important. We are social animals, and that's really what our brains were primarily designed to do, is to engage in social interactions. And that is the best way to exercise our brain, is by doing social interactions. Now, another thing that's been shown to be helpful for brain health and memory and cognition is to engage in novel, note the word novel, stimulating cognitive activities. So it can't be the same old thing again and again and again. It has to be different, has to be new, has to be novel. Now, some people say, well, I play a musical instrument. Does that count? The answer is it counts if, in addition to playing the same tunes you played for many years, you also learn new tunes, or maybe even a new genre of music. If you used to play show tunes, now you learn jazz or classical or vice versa. Okay, that would keep it new, keep it novel, and keep it stimulating. And the last thing I want to mention is, it sounds like pop psychology, but keeping a positive mental attitude really makes a difference. And again, it has been shown in study after study after study. Okay, now what about those brain training games? I'm sorry, there's just simply not enough evidence, in my opinion, and I actually just re-reviewed the literature on this topic for even a brand new book I'm writing. Not enough evidence for it yet. But I'm 100% sure that it's better than TV. The other thing is, I'm not knocking these activities, okay? If after a full day of exercising and eating right and socializing and having a good attitude and doing new things, you're exhausted, you want to spend the rest of the evening curled up in a chair and doing a crossword puzzle, that's totally awesome. What I don't want to happen is, you have your friends that are trying to get you to, come out and go for a walk, now that we can be 6 feet apart wearing masks if we're vaccinated these days, right? Your friends are trying to get you outside to go for a walk, and you're like, no, I have to stay inside in my windowless room and work on my computer game so I can help my brain. Don't do that. Go walk with your friends. Okay. Now, another thing that we put into the book is we put in all sorts of memory strategies, okay? We talk about how you can use mindfulness to practice active attention and improve your attention, and thereby improve your memory. We talk about how important it is to repeat information that is spaced out over time. You can make connections and associations between things that are new that you're learning with things that you already know. You can create visual images to really help solidify things in your brain. You can use the same method that the Greeks used more than 2,000 years ago to remember lists of almost anything. You can invent a catchy rhyme to remember almost anything in no time. And I'm sure you can do better than me. And we also have a whole section on learning names and retrieving names of people you already know. And I have a little section on that in this talk later on, if people are interested in hearing more about how to remember names better. We also spend a lot of time talking about memory aids. So these are things that everyone can use of any age to remember things better day to day. How you can have a memory table or tray or bowl where you put all the things you're going to need to remember when you walk out of the house, like your cell phone, purse, pocketbook, keys, glasses, wallet, things like that. How you can use a pillbox, and there's a lot of different types out there, using calendars and planners, notebooks, lists, post-it notes, how you can use your smartphone and use apps that can help you out. There's all sorts of memory aids that can help. There are some golden rules when it comes to memory aids that I'll just go through briefly with you. The first golden rule is don't delay. So if you have gone through the trouble to set an alarm on your watch or your phone to remind you to take a pill, if that alarm goes off, don't delay. Take that pill right away, or you might forget. Second golden rule is keep it simple. And what I mean by that is, if I inspire you again this afternoon and you say to yourself, I'm never going to forget another appointment again. I'm going to get a calendar for my work, and one for the refrigerator, and one for my desk, and one for my pocketbook. Like, wait a minute, don't get 4 calendars. That's going to create utter chaos. You're always going to be copying things from one calendar to another. You might mix it up or forget to put one in the other, and it'll be a disaster, right? Just have one calendar, right? And keep it with you. And maybe take a few pictures of it with your cell phone, just in case you lose it. The last golden rule is make it routine. And what that means is that even if a lot of the different things I've talked about in terms of strategies and memory aids may be a little bit new, may take a little bit of effort to do, once you do it all the time and you make it routine, it becomes easy to do and effortlessness. So you just need to make it routine. Now, the last thing that we talk about in our book, The 7 Steps to Managing Your Memory, is how to plan your future. And in this section, we say, like, well, what do you do if you have some memory problems? How do you keep doing all the things you enjoy doing in life? How do you keep working? How do you keep driving? How do you keep doing your hobbies? And how do you do all these things safely? We also talk about, how do you know when is it time to retire from that job? How do you know when it's time to hang up the keys and let someone else do the driving? So those are the 7 steps to managing your memory. If you want some more information, it's in the book. And although, of course, I would love to get the 50 cents for each copy that I'm given by Oxford University Press if you purchased a copy. But I'm very pleased to say that most libraries have a copy of the book as well. So in all seriousness, you don't need to buy it. Just check it out of the library if you're interested. You can also poke around on my website. I have additional information there as well. I have a blog on Psychology Today. I have a blog on Harvard Health. And so there's those blogs as well. You can email me with questions. My Boston University email is right there on the slide. And if you Google me, you can easily find it as well. You can follow me on Twitter and Facebook as well. So what I'm going to do, I'm going to stop sharing and I'm going to pause. And I see we have 39 items in the chat, and I'm going to work on answering your questions. And then after we're done with at least the majority of the questions, we can sort of decide together whether or not we want to hear a little bit about names or a little bit about more advanced dementias in the moderate to severe stage of Alzheimer's or dementia. I'm happy to go through some slides there, or just keep answering questions. Okay, so I'm going to go to the top of the chat. If this is okay with everyone, is this okay, Stephen, if I go to the top of the chat and just start answering questions?
Yes, and anybody who wants to raise a hand and ask their question, please feel free to do that. It's nice to keep it personal.
Okay, so okay, so right, so there's a comment that sometimes people do tell the same story and again, even when they're young. And I agree, sometimes there's psychological reasons that stories will be repeated that have nothing to do with memory problems. And Another comment that Stephen made is that he has difficulty remembering names for his whole life, but he never forgets a face. And I will say, I think I fall into that camp too. My standard line is, I went into memory disorders to try and help my own pathetic memory. That's my standard line. Okay, let's see. Yeah, okay, so let's see here. So a Wall Street trader type told me once, you only have so many brain cells. Why clutter your brain with info that is not useful or needed? Just flush that out and focus your thoughts. So I will tell you, one of the things that we now understand is you can absolutely, just as you're saying, Mano, you can absolutely sort of choose what bits of information you are remembering and what things you are forgetting. And you can sort of tag a memory as important by all sorts of things. Just by saying to yourself, this is important, I need to remember it, that will help you remember it. And you can consciously try and snuff out memories that you don't need or don't want. You can just let it passively happen. And it turns out if you write things down to remember them, or you say you type it into your phone or your computer so you don't have to remember it, that is another tag to your brain that tells you you don't need to remember that, and you won't remember it as well. So you can tag memories to be used and tag memories to be forgotten. Having said that, we don't think there's a real strict limit to how much you are able to remember. The only thing that I would say is, you remember we talked about that we consolidate our memories each night when we sleep? So there is evidence you can only learn so much of a certain type of information on each day before you sleep and consolidate it. I think it's one of the reasons that schools tend to have, and everything from grade school through college, that schools tend to have classes that you have 2, 3, 4, or 5 days a week, okay, rather than you have like all English on Monday, all science on Tuesday, all history on Wednesday, right? You have each of those classes a couple times a week, and it's so you can sleep and consolidate that memory each time. But don't worry about having extraneous things in your brain, but you definitely don't have to. Okay, so individual differences, yeah, there are definitely a lot of individual differences. So much of the things I'm talking about are going to be averages, generalization. So agree with what everyone is saying. Yeah, and here's a comment that you heard about cases where autopsies reveal amyloid in people whose memory was apparently fine until death. And this does happen. In fact, one of my colleagues, Yakel Quiroz, who is from Colombia, South America, she and her group studied a family member that have one of these genetic mutations where they get, in general, they get Alzheimer's very early if they happen to inherit it, which is a 50% chance. And normally they get it in their 30s, 40s, or 50s. And this was someone who had inherited it, had a head full of amyloid, but did not develop dementia till very, very late in life. And we're working on trying to understand, why is that the case? How come some people can have a lot of amyloid and not have it impair their memory, and other people it does? And one part of the answer I actually told you in the talk, which is that it's the tangles that are actually what's causing the brain cell death and the memory loss. So typically in Alzheimer's, we think the plaques happen first, the plaques then cause tangles, and it's the tangles that kill the brain cells. So if you have amyloid, but it doesn't cause tangles, then there won't be death of brain cells. But why do some people with amyloid not cause tangles that we're working on. But I do want to stress, this is like a tiny percentage, like less than 0.1%. So it's not very common. Okay. So, so there's questions about some substances. Yeah, I don't know that I agree about the NBREL comments, but I think that is open for debate. Open for debate. So the Mediterranean diet you ate in France contained meats and fried foods. Well, guess what? It's called the Mediterranean diet. I did not make up that name, but French food is not part of the Mediterranean diet. It's mainly Italian and Greek food and Israeli food and Egyptian food, Moroccan food. It doesn't really include French, unfortunately. Okay, and then there's comments about exercise. Yeah, so fish, there's different types of fish. I think the main fish that people have to worry about is if it contains too much mercury, and that is a problem. The NIH actually has a good website on fish that you can work on avoiding the mercury. How about the keto diet? So the keto diet, I think there isn't strong evidence that the ketogenic diet in and of itself is going to help your brain or thinking or memory. But having said that, if someone is obese and the ketogenic diet can help them to lose weight, having a normal weight is so important because it correlates with high blood pressure and diabetes and high cholesterol and all sorts of things that can dramatically impair the memory. That if the ketogenic diet helps one to have a normal weight, then I'm all for it. But if you are already a normal weight, I don't know of any studies to show that the ketogenic diet is better than following a Mediterranean diet. And I have someone here saying yoga in capital letters. I'm totally with you. A big fan of yoga. Tai Chi also, yes. And again, yoga and Tai Chi, are not usually, it depends how you do them. I actually am a big fan of power yoga, which you can be aerobic as well as doing yoga. But if you do, regular yoga, Tai Chi, that generally doesn't count towards your aerobic exercise, 30 minutes, 5 days a week. But it's still important because you need to do that 2 hours each week. So I definitely want you to do that. Yoga is what I do. I'm a big fan of yoga. Try and get that in once or twice a week. So anaerobic versus aerobic exercise. So most studies show that it's aerobic exercise that is the key. So exercise that's aerobic, that gets your heart beating quickly. There are absolutely some studies that show there's benefits to anaerobic exercise. One of them showed that the white matter tracts, which are the wiring, the connections between the brain cells, was helped with anaerobic exercise. So definitely good with that. Proprioception and coordination as well. And yeah, so like if you're sweating when you're doing yoga and Tai Chi, and that's one of the things that is helping you, there's no doubt about that. Now, there's a comment here about anesthesia being a memory risk. So what I would say is there's different ways that anesthesia can affect the brain. So sometimes anesthesia does not go well, all right? And there can be drops in blood pressure that can damage the brain accidentally. The other thing that can happen is that a person that may have tendencies toward memory loss, maybe sort of developing Alzheimer's disease, but maybe would develop it a couple years later. if they get anesthesia, it can make them confused, okay? So those are two different ways that anesthesia can cause memory impairment. The bottom line is that properly administered anesthesia should not cause a permanent loss of memory in terms of my reading of the medical literature. And I have just recently reviewed this. Sleep deficits, I totally agree with Stephen. It is bad in terms of drinking and driving. Is the failure to grow new brain cells part of the Alzheimer's problem? That's a really good question, Muriel. And I would say that people don't know the answer to your good question, but I have wondered about that as well. And the places where we're losing brain cells and growing new ones, Susan Gibson seems like she knows a lot about this. I agree that it turns out there are a few different places in the brain where we grow the most, which is in the hippocampus, which we've been talking about. Okay. Stephen's commenting about brain volume of cells versus hydration. It's true, hydration actually makes a big difference, but you can still compare brain cells when you're young versus brain cells when you're older, and you can be hydrated or dehydrated equally each time. And trust me, I've looked at a lot of MRI scans. The brain does shrink, both as part of normal aging, but also in diseases. The brain also shrinks, by the way, sleep shrinks tremendously, and that's one of the ways we flush out all sorts of things we don't need, including beta amyloid. So hydration would be water. Okay, I commented on the keto diet. Ginkgo biloba. So I think the evidence shows, in terms of my reading of the literature, and you know what? Some of you may disagree with me, and I'm very comfortable with that. But my reading of the literature is that ginkgo biloba does not show benefits. Muriel is commenting that strong emotions create strong memories, and I totally agree. That's one of the ways that we tag a memory as important, that we should remember it later. Donna Lee commented that, as a friend in the beginning stages of Alzheimer's, no driving allowed, would your book help someone already dealing with it? And the answer is yes. In fact, my book is specifically written for somebody who has noticed a little bit of memory problems as they're aging and is trying to figure out whether it's normal, whether it's not, and what to do about it. That's why the subtitle is What's Normal, What's Not, and What to Do About It. So it is absolutely written for somebody with some mild memory problems. My own opinion about driving is that I simply think a family member or a close friend should be in the passenger seat while the patient is driving. Essentially they're in the death seat, right? And as long as the family member or friend is very comfortable with the patient driving, then I'm comfortable with the person driving. But if they're holding on for dear life, no, stop, wait, don't do that, then I think they can't drive. But I don't think just a diagnosis alone is enough to stop someone from driving. So there's a question about comment on researchers referring to Alzheimer's as diabetes type 3. So what I would say is there is thoughts that Alzheimer's may be related to abnormal insulin resistance. And there's all sorts of different trials of intranasal insulin and other diabetes drugs that are being tried to treat Alzheimer's. As far as I know, none of those have been positive in large-scale studies. But there's absolutely all sorts of ongoing work on that. And it may end up being positive, but so far, not yet. And I want to be very clear, Susan, I'm totally on the same page with you. You're talking about the drugs do not delay the cognitive decline, they address the symptoms. I totally agree. They're symptomatic drugs. So part of what a symptomatic drug can do is it can turn the clock back. So essentially what I'm quoting is the review in JAMA a couple of years ago, I'm forgetting by Jeff Cummings, that talks about ADAS-Cog scores, and you can convert ADAS-Cog scores to sort of months, okay? Because people normally decline a certain number of ADAS-Cog points, every 6 months, every year. So that's what I mean when I say it turns the clock back. And I tried to be very clear, these drugs, they just give you a little bump up and then you decline along a similar slope. I was not at all trying to imply that they impact the rate of decline. There's new things, like we said, that are trying out antibodies against, amyloid and tau that can do that. So Susan, you and I are on the same page. Thyroid deficiencies, I did mention very briefly that if there is hypothyroidism or hyperthyroidism, either one of those can impair memory problems. So definitely a thyroid screen in the blood, usually TSH and a T4 is part of a regular workup. So the question about what do I think of Dale Bredeson's work? So, I'll just say very succinctly, and I don't want to get into a big debate about this. I've read his book carefully. I've heard him talk. I think a third of what he says is exactly the same thing as what I've just said to you, talking about, Mediterranean diet, exercise, things like that, okay? Then there's a few other things, that he might be right. I'm not sure. I just sort of put in the category of like, it needs more study. Is curcumin good? Maybe. I just think it needs more study. Is resveratrol in blueberries and red wine good? Maybe. I just don't think it's been proven yet. Is it going to hurt you to eat Indian food and have curries and have blueberries? No, it's wonderful. There's no problem there. I think that's great. I actually eat blueberries every day just because I like them. And I ate Indian food this past Saturday. It's great. Am I convinced it's going to help Alzheimer's? No, I'm not convinced. And then I think about a third of what he recommends in his protocol, some things like, giving up, all grains entirely, including whole grains. I don't think there's evidence for that. Doing chelation therapy in some cases, I don't think there's good evidence for that. So about a third of things he and I just respectfully disagree with each other. Okay, thank you, Liza, for your comment. What do I think about the beta amyloid hypothesis? Why have all the drugs pursuing beta amyloid as targets to reduce, but didn't do anything to improve cognition? Not even a trend. Yeah. So I will tell you, I think that I am very much a fan of the hypothesis that a number of people have worked on, but Rudy Tanzi at Mass General has, I think, done some of the best research on, that suggests that the normal function of beta amyloid is to help the body, the brain, to get rid of infections. Okay, there's a lot of evidence in my mind on that. I think some of the evidence comes that in certain peoples in New Guinea who have a high rate of parasites, those people who have an ApoE4 allele, which predisposes to make extra beta amyloid, those people survive better and have fewer parasites in their brain. Okay, so that's one line of evidence. Another evidence that Rudy Tanzi did a study that he has mice that are genetically engineered to produce beta amyloid, but they tend not to do it until he puts some bacteria on the brain, and then bam, overnight, brain is covered with amyloid. So I'm convinced, it's not proven, but I think it's likely going to turn out to be correct. I think it's one of the reasons that, so, could Alzheimer's actually be caused by an infectious agent? And the infectious agent is then stimulating the brain production of beta amyloid. And the beta amyloid is like doing its best to get rid of the infection, but as a consequence, it creates all this inflammation, and that can then cause the damage to the brain cells, cause the tangles to form, and cause Alzheimer's. So I think it definitely could be that. I still think the amyloid plays a role, because I think, I would say the amyloid is like part of the inflammatory system. So if you have more amyloid, it's going to cause more inflammation. And the other reason I think you have to agree that amyloid is part of it is you have people like this family in Colombia, South America, that I talked about, that have a genetic mutation that's well understood that causes more amyloid to be produced. And these folks have Alzheimer's disease when they're very, very young. And I have had some of these patients in my clinic. It looks like every other type of Alzheimer's disease. So I think that, it's really been proven by the clinical trials that simply removing the amyloid, does not appear to cure this problem, but I still think it's involved in some way, shape, or form. Okay, might glycophosphates, other pesticides and toxins affect memory? Sure, absolutely. And I would say in terms of toxins, there are some that we understand, like manganese, we understand is a toxin to the brain. Mercury, we understand, is a toxin to the brain. There's a lot of other toxins we just don't understand. So I work at the VA hospital in Boston, as you heard. And, a lot of our veterans are exposed to all sorts of things. Agent Orange is just one of the things we know of, and they're exposed to a million other things. Is some of it impairing their memories? I mean, I'll tell you what I tell my veterans in my clinic, we don't really know. There hasn't been enough research on this, but there's no doubt that all sorts of toxins and pesticides, things like that, those are not good for the brain. Karina and Ryan says, any relationship between inflammatory markers like homocysteine and memory loss? The answer is yes, that has been studied, and higher levels of homocysteine have been related to more Alzheimer's. The problem is that there have been some studies that have tried to lower homocysteine rates with B12, B6, and folic acid. And at least according to a large Alzheimer's disease cooperative study, which was well done, our center was part of that study, it was negative. I still recommend, B12, B6, and folic acid to make sure everyone's levels are up to normal. And even for B12, a little bit higher. I would prefer it around 500, whereas the normal level would be around, 250 or something like that. I would prefer to be around 500, but there's just not evidence that mega levels of those vitamins are going to help. The other vitamin no one has mentioned here is vitamin D. There's evidence that low levels of vitamin D are associated with Alzheimer's disease in particular, and dementia in general. Have you heard about these new Alzheimer's living facilities that help elders pretend that life is normal? I have, actually. They're often called dementia villages. I don't know if that's what you are thinking about, Muriel. But these dementia villages, I think, are wonderful. I actually have one of the fellows who is working with me both in the clinic and the lab. Now, I'm training her. She's a geriatrician, but she's also an architect. And she is working on trying to study scientifically the effects of these villages. I think it's just wonderful because, I think most of us, we want better quality of life, right? It's not all about quantity of life, it's about quality of life. And if we can help individuals with Alzheimer's to sort of have like a normal, existence, I think that's the way to do it. Neelam Singh asked me about autophagy process, about long intermittent fast. You know, will that clear the amyloid tangles? There's a little bit of confusion in the question because amyloid is plaques and tangles are made up of tau. The question, you know, I just don't know the answer. I don't think it's been studied to know whether fasting will get rid of amyloid. What I would say is if it helps you maintain a healthy body weight, it's probably healthy. If otherwise, you would be overweight or obese. But the most recent data that I have seen is that intermittent fasting, you lose more muscle than you lose fat. So I'm not sure it's the best way. I definitely said that falls can cause memory loss. The mechanism is if you hit your head. That's what I'm saying, is that you can damage yourself by hitting your head. If you fall and you just hit your hip or your knee or your wrist, I don't think it's going to cause memory problems. A question about choline supplements for vegans. Vegans are at risk of all sorts of vitamin deficiencies. I'm not saying it's a bad way to be, but you are at risk if you're a vegan of vitamin deficiency. B12 can sometimes be difficult to get. There may be other vitamins that are difficult to get. I don't believe that, at least as far as I know, choline is not a particular lack in vegans, but I may be wrong. I'm not an expert on vegans. Do I know about the relationships being done on the gut? Yeah, so, you know, I will say that I think it is one of the most exciting areas of research is to look at this relationship between the microbiome of the gut and the brain, and whether or not, like some of these, you know, fighting against infections, like maybe if we just have our gut be healthier, then we're going to have fewer infections that are going to go up to our brain and we'll have less Alzheimer's. I mean, I think that would be interesting. Would a fall be, would it likely be vascular damage? So if someone falls and smacks their head, the thing that can happen is you can get a bruise on your brain, just like you fall and hit your arm, you get a bruise on your arm. And because the brain is in a skull, there's no room for things to go, so it can compress the brain tissue and cause damage. Okay, all right. Whew. I think I
have
finished
2 hands up.
all the questions. Yes, yes.
Karina
Let's go to the
and
hands up.
Ryan, do you have another question? I know you had one in the chat, but
No, that was my way of submitting my question. Thank you. Though it was disappointing to hear that high levels of B vitamins might not help. Were those methylated B vitamins or standard B vitamins?
You mean the cofactors? The cofactor form?
Yeah, when I said the B6, B12, and folic acid, look, what I would say is the study was done with the standard vitamins. So it's possible that if you use, you know, more methylated, more bioavailable vitamins, it might work better. It just simply has not been studied. But you know, that would be another thing that I'd put in the blueberries and the curcumin. I'm not opposed to it. You know, it might work. It just has not been studied. Right, as I think you can hear, for better or for worse, your speaker today, you know, I'm very sort of by the book. This has been studied, this hasn't been studied, you know, but I think things that haven't been studied may still work. I'm just not going to espouse them if they haven't been studied. That's all. Ivy is trying to unmute herself.
Thank you. I have a question which, from my point of view, you don't really need to answer too scientifically, so it can be just an intuitive response. I wondered about Elon Musk's contribution to neuroscience with his project about inserting those chips or working on those chips that are relating to brain function and memory and all these neurological aspects. And I don't know how well researched they are in principle or by him, but I was interested to hear what your response might be.
Yeah, so I just want to make sure that I am familiar with it. These are, it's essentially a machine biological interface. Is that correct?
Yes, yes.
Yeah. So I think that, would be tremendously exciting, just tremendously exciting. I mean, wouldn't it be amazing if we could just, have a little accessory hard drive, right? You have something like this, just, hooked up to your head, and if I want to know every anatomical term in the body, I can put it on, and then I can give it to you, and you can have every anatomical term in the body, or every drug and every side effect and every drug interaction, or anything else I'm trying to remember. I think that would be really cool. And it would bring up all sorts of ethical questions. It would bring up all sorts of practical questions, but I'm very excited about things like that. I think that would be wonderful.
Thank
Muriel
you.
has her hand up.
Yeah, I also put this in the chat, but I don't think you're looking at it anymore. So I hear that you're a fan of like controlled studies.
Yeah.
What I'm wondering is, have you explored Bayes statistics as well as the sort of standard frequentist statistics? Because reality is more than just like, oh, a p-value is less than 0.05. Now, I'm not a statistician. I can't pretend I understand Bayes, but what I think I understand is that you can like shift direction in the middle of a trial with Bayes statistics.
Yeah, Muriel, I think you and I are, I think, mainly on the same page. I hope, I answered lots of your questions. I hope you were pleased with at least most of the answers.
Oh yes, I'm quite enjoying it.
Okay. So look, I don't want to get into a debate with anyone on this stuff. I mean, I don't. I also, look, I do my best to answer honestly and go with my interpretation of the literature and my best guess, so, that's what I do. So I hope that's okay. Other questions?
Well, I have one.
Yes, please.
That I wanted to ask you about your file clerk analogy.
Yeah.
In terms of how you were talking about the file clerk making decisions about like where something gets filed, but I'm also wondering whether or not that kind of executive function is prioritizing ideas based on what's novel, what's important, or what may be associated with, let's say, an norepinephrine spike because of some emergency or threat, like being chased by a bear or something like that.
Absolutely. Yeah. We didn't talk at all about, what are the things that sort of make something more likely to be remembered rather than something else. And, if it's okay, maybe I'll just go through just a couple more slides that will talk about sort of how you can actually sort of improve your memory for information. And I'm going to do it in the guise of, how can you remember names better? But it really can be for anything. So the first thing that you have to do in terms of being able to remember information better is you have to sort of pay attention to it in the first part, right? Okay, and you can actually learn to pay attention better by using mindfulness. When you're learning names, one thing you can do is you can work on spelling the name, okay? And that can help you. Repeating the name is critically important. If you can repeat it out loud, that's ideal. But if you can't, repeat it to yourself. It's good to sort of make a little remark about the name. Again, if you can say it out loud, that's best. You want to make an association with the name. And then getting, Stephen, at something that you mentioned, it's important to create a distinctive visual image. That's going to be something that's going to help you to be able to remember that name better. And again, you can use this with any information. I'm just using names as an example. And if you're trying to remember a name and put it to a face, you want to try to find a facial feature that you're going to remember and then connect that visual image to the facial feature. And I have a little example here. So let's say you're introduced to someone and he says, "Hi, my name is John." And you say, "John, is that J-O-H-N or is that J-O-N?" And he says, "Oh, it's J-O-N for Jonathan." You say, "Well, very nice to meet you, John." And then you can make a remark like, "Oh, you know, my best friend growing up was named John for Jonathan." And then you want to make an association. And I actually made up this example this afternoon. And the first thing that I could think of with Jonathan was Jonathan Swift. Now, some of you may know that Jonathan Swift wrote a book called Gulliver's Travels. And in one part of his travel, he was perceived as a giant to people, and they tied him up overnight when he was sleeping. So this is the image that I have created, was this distinctive visual image of John being tied down with rope. So I'd be picturing John, but instead, being tied down with ropes. And in terms of the outstanding facial feature, maybe he's got a cleft in his chin, or maybe his brow is furrowed, or maybe he's got a big nose. And if so, you can imagine like the ropes going through that cleft in his chin or that furrowed brow, or maybe it's going around his nose if he has a large nose like me, okay? And then you'll want to repeat the name sometime in your conversation, like, "John, that's a real excellent point," or "It was great to get to know you, John." And then later, maybe when you're driving home from your dinner party, you think to yourself, or you say out loud, "I met John today and we talked about our tennis injuries," or whatever it was that you'll talk about. And you'll remember that name for a long time. Now, some of you might be saying, "Oh my God, you got to do all that to just remember a name?" And the answer is, there is no free lunch out there, ladies and gentlemen. So if you want to remember a name or some other piece of information, putting in effort does help. Now, like Stephen was saying, if it's something that frightens you, yes, that's also going to cause you to remember it. Or if it triggers some other strong emotional reaction, yes, you're also likely to remember it for that reason. But if it doesn't come on automatically, you got to put in effort. And I just have a couple, I think 2 more slides just on recalling names. So this is a slightly different scenario. So here, let's say you're, attending a social event and it's somebody that you see like every year and you've seen them for the past 10 years and boy, you should know their name, but it is not coming to you. So first thing is to relax, okay? Because it's amazing how anxiety will make it 10 times harder to remember that name. So you want to relax. You want to work on not blocking the name. We often do that inadvertently. We block the correct name with a similar name. Instead of blocking and trying to think of the name, the best thing to do is to think about other things you know about the person. That will cause your little network associated with that person to be active, and their name might pop out from there. That's one of the reasons that when you walk away from someone, that's when you remember their name. And another thing that works for lots of people is to run through the alphabet until you get to the name. The other thing is, like, if you're going to like a reunion or you're going, to, maybe a Passover or Easter event or something like that, and you're going to see somebody that you've seen every year, review the names ahead of time. It's not cheating. There's nothing wrong with that. And the last thing I have here is, don't worry if you forget someone's name. If you forget it, big deal. Just say, I'm blanking on your name. So here's a little example. So to relax, take a nice, slow, deep breath as she's walking over and you're trying to remember her name. And again, don't block the name with a similar one. So don't keep saying to yourself, Mary, no, it's not Mary. Is it Marie? No, it's not Mary. It's not Marie. It's not Mary. It's not Marie. Every time you say Marie and Mary, it blocks the right name. So think about other things, you know, you went to college with her, she lives in Connecticut, she has 3 children, and then you run through the alphabet and you realize, gee, it's Gretchen, that's her name. And it's Gretchen for Margaret, that's why the M's were sort of popping up and were blocking the right name. And, you know, again, you know, nothing wrong with reviewing the names in the yearbook and nothing wrong with saying you're blanking on your name. So I hope some of you found that useful. Thank you, Steve, for letting me jump off on that. But I wanted to make sure I fully answered your question.
Well, I had another aspect to it too as well, but that was my favorite thing because I've had this lifelong history of not remembering names anywhere near as well as remembering faces. But I did have an experience with memory at one point in my college education that had a profound effect on me, and that was the realization that the context under which you're trying to remember something, if it's similar to when you learned it, it's easier to recall. And so this is one of the problems that I was having with studying, where I would study in a relaxed state of mind, and then when I'd be faced with a test, I'd be anxious. Yeah. And that created memory problems. And so there was one time when a professor sprang a surprise exam on us, just, you know, show up in class on Monday and there's an exam. and I went through this freak out process, and then I basically said, well, okay, you know, I'm not prepared. Don't worry about it. Just have some fun with it. And so I did the test, and as I expected, I didn't do very well. I did, you know, I scored 50%, you know, which for that kind of a situation was pretty piss poor. But it turns out that I had the highest score in the entire class.
Yeah.
Because I wasn't freaked out when I was actually answering the questions, but, you know, everybody else in the class stayed freaked out.
Yeah.
When doing the exam.
Yeah, no, it's a very good point. And in fact, you know, you'll do better on your history test if you study your history in your history classroom where you're going to be taking your test. You know, if the classroom happens to be open in the evenings or whatever, you know, you'll actually do better. The downside of doing something like that is you'll only remember history, you know, when you're in your history classroom. And maybe for history, that's okay. But if you're studying like French or something like that, you don't only want to remember your French vocabulary in your French classroom, right? You want to remember it when you're sitting in the cafe in Paris and you're trying to order from the waiter. So the best strategies for something like that is actually to study in a variety of different locations. And to your point, you know, it's probably good to study under a variety of different emotional circumstances as well. But in general, I don't want to say you should study when you're stressed. It's probably better to work on like relaxation techniques to be less stressed when you're taking exams. But none of us knew that when we were in college, right?
I often have the situation when I meet something to imagine what it will be like re-meeting them at some point in the future.
Yeah, I think that's great. That's another good way. JP, looks like you have your hand up.
Hi, yes. When you mentioned the Mediterranean diet, I'm wondering if like eating grass-fed meats and dairy products is as good as fish. I mean, is it about the omega-3? So if they have a greater omega-3 to 6 ratio?
Yeah, so I have to say that whether it's grass-fed, you know, cows producing, you know, meat and dairy or not, like I'm sure it's better to have the grass-fed cows, but those are still, you know, the meat in red meat in particular, I think is a once in a while food. It's just not an everyday food. You know, you tell me you want to have it once every 2 weeks, I'll say fine, but it's just not like an everyday. It just shouldn't be an everyday food, and it should be in moderation as well. One of the things that I think is ridiculous, I'm going to get on my soapbox for a second. You know, you go to a restaurant and you order a steak and it's like, do you want an 8 ounce, a 10 ounce, or a 12 ounce steak, right? And probably having a 4 ounce steak would be plenty, but you order the fish and what they give you, like the tiniest portion in the world, right? It's like totally unfair. They should give you a lot of fish because the fish is what's healthy, and you can eat lots of fish. It's not going to hurt you. The dairy, I do think that many people with a Mediterranean lifestyle have yogurt. A little bit of yogurt, a little bit of milk, I think is fine. I think you don't want to overdo it there either. Is grass-fed better? Yes. But does that mean you can eat meat just like you eat fish? No, I don't think there's evidence for that.
Okay, thank you.
Other questions?
Susan, how about you? Have you noticed a question that has been neglected?
No, I haven't, but it certainly covers the gamut. There are a lot of people who are looking at natural ways to, prevent going down this pathway. And I remember recently on 60 Minutes, they mentioned some new item that was very heavily correlated with getting dementia and didn't seem to be totally connected to the amount of tangles in the brain. Are you aware of what that might be?
So it's something that's related to COVID or not related to COVID?
Not related to COVID, no. It says it's something something or other that they found highly connected with dementia, but not correlated with the tangles as much.
I apologize. I
Don't worry about it.
I can't think of what that would be.
Okay.
Maybe someone if your audience does.
Not a clue.
I have to ask Susan Gibson what your background is. You seem to know this stuff inside and out.
Oh, Susan, that was directed towards you. Oh, she just muted herself.
No, I'm unmuted now.
Oh, okay.
Well, thank you for asking.
Oh, good.
Actually, by background, I'm a pharmacist and spent 30 years at pharmaceutical companies developing products. My mom got dementia. I started a company educating people on the things they can do to help their memory. So I've studied all the literature, gone to the dementia meetings. So yeah, this is near and dear to my heart. So I really appreciate the perspective. It's been great.
Wonderful.
Yeah, thank you.
You also had a very good turnout.
Yeah.
Yeah, and so I'll just say again, if it's okay, that if for those of you who do have a loved one with dementia, and they're working on trying to manage the dementia without pharmacology, I actually work sort of very hard in this other book. I'm just going to put it on the screen for one more minute here. This 6 steps to managing Alzheimer's disease and dementia. We talk extensively about all sorts of non-pharmacologic ways you can manage memory problems, language problems, vision problems, behavior problems, manage incontinence, manage sleep, all these sorts of different things, and we do talk about medicines too, and which can be helpful, and more importantly, which can hurt, right? We have like a short chapter on the ones that can help and a very long chapter on the ones that can make things worse. So I hope that's helpful for some of you, if any of you are caregivers to friends or family that are going through that.
Muriel has a great comment here. I have a button I got at a conference. Hi, I don't remember your name either.
I love it. I love it. I think that's great. All right, Susan, Stephen, other things we should chat about?
No, other than thanking you for an outstanding presentation.
Yes, thank you.
My pleasure. No, it was absolutely my pleasure to chat with all of you. I hope you found it useful.
I'm sure everybody did. All the comments are in direct alignment with that.
Good.
How about answering all those questions you posed in the beginning?
Oh, sure, sure, I can do that. Yeah, absolutely. That'll actually be fun. I don't normally do that. So you walk into a room to get something and forget why. As I mentioned, that is totally normal, okay? And it's generally due because we get distracted, right? You see something else, or even you distract yourself with a thought and you don't remember, but that's normal, okay? Now, trouble remembering details of your life, such as your wedding. Well, the fact of the matter is, although emotionally important events should be remembered, if for whatever reason you really haven't thought about your memory in 30, 40 years, you haven't thought about your wedding in 30, 40 years, it's normal to remember a lot of the details about it. So that's actually okay. I mean, you should still remember that it happened and where it is and stuff. But if you don't remember a lot of details and you haven't thought about it in 20, 30 years, that's actually okay.
Like who you got married to. Remember that.
You should remember that. I agree with you, Stephen. Now, when you're driving and not paying attention that you may end up somewhere you did not intend to be, totally normal. What typically happens is, let's say we want to go to the bank, but going to the bank is very similar to going to our daughter's school. And so you're thinking about, the rest of the things you're going to do that day, and you end up in the parking lot of the school. Totally normal. Again, you just got distracted. And so you went on autopilot and ended up at the school. Finding your car in a parking lot, that's sort of an unfair question because it all depends, okay? If you were distracted when you were parking your car, and this has happened to me, you're on your cell phone, you're transferring it from your Bluetooth in the car to the phone, and you're concentrating on your conversation and you're walking out, you may have no idea where your car is because you weren't paying any attention to it. On the other hand, if you paid attention, okay, this is where the car is, I'm going to pay attention, I'm going to remember, and then you can't find it, that could be problematic. And I did answer the family telling you that you've asked that question before. If you do it once or twice, no big deal, but if you're doing it again and again and again and again, and you're driving everybody bananas, that's a problem. Like I had one family member that said, Dr. Budson, I finally decided to make an appointment with you after my husband asked me 16 times on a 2-hour trip, where are we going? So.
Muriel has a comment here about the way music can reawaken memories in those with dementia.
Yes, that's a wonderful comment. And that is something we actually talk about in both books. And we actually did a study in our lab that showed that healthy older adults did not remember information better with music, but patients with mild Alzheimer's disease did. And so, number one, music can help people remember things better. But I totally agree that music can be particularly beneficial for those in the moderate to severe stage of Alzheimer's. It can help them remember things better. It also can activate people who are very passive and withdrawn and apathetic. It can bring them out, get them more engaged. And it also can help to calm people who are angry and agitated. So music, it can be very wonderful. And there's a wonderful movie that's like 1 hour and 15 minutes long called Alive Inside. It is, I think it's available both on YouTube as well as Amazon Prime. I actually last saw it I played it for my class. I teach a class at BU, and I played it for them. And I got it through Amazon Prime for free. Just a wonderful video. I strongly recommend it if you're the least interested in music, memory, or dementia, to check that video out. Other questions or comments?
It seems we're just going to keep this rolling.
Yeah, no, that's fine. That's fine.
Yeah, great work. Thanks. Thank you very much. Wonderful presentation. Very nice info. Thanks.
I like the 2 thumbs up.
Super presentation.
Thank you, Susan and Susan. You're both giving me 2 thumbs up. Thank you, Richard, for the claps. Why is rice bad? Well, white rice is bad because it's very quickly, it's simple carbohydrates. It's very quickly broken down into sugars. And if you have brown rice in moderation, you can't go overboard, but a little bit of brown rice will be fine because your body will metabolize it slowly. But white rice is bad, just like white flour is bad, just like plain sugar is bad, just like white bread is bad, because it just very quickly goes to sugar. You get big spikes of insulin, and there's no doubt that that's not good for your brain. It also makes you hungry, and you'll end up eating more. Okay. All right. Well, I think I'm going to sign off and let all of you get on with your afternoon. But it really was a pleasure talking with you all. And who knows, maybe we'll get Susan and Stephen to invite me next year, and we can talk about some new things, some new developments, things like that.
Excellent idea.
You are invited.
Great. Wonderful. Wonderful.
Just
Okay.
tell us when.
Okay. All right. We'll be in touch by email.